Dear students, hope all are doing well. Today, I am going to discuss the histology section cutting, also called as microtomy. Microtomy is the process of sectioning soft tissue or decalcified tissues like bones and teeth and affixing it to a glass slide for further microscopic analysis. These fundamental principles apply to both paraffin and frozen sections. Although the majority of microtomy is conducted on paraffin wax embedded tissue blocks. Now, how to take the microsections from the paraffin embedded tissue block? The microtome is the tool used for sectioning. This machine has a device that moves the paraffin block a certain distance until it touches the cutting knife or a blade. Now, how to take micro sections from the given paraffin embedded tissue blocks? The microtome is the tool used for sectioning. This machine has a device that moves the paraffin block a certain distance until it touches the cutting knife or a blade. Next, what are different types of microtomes are available in the market? Numerous varieties of microtome are available, each with a distinct function. However, many may serve multiple purposes. Here, I have mentioned different types of microtomes for your better understanding. Dear students, please note the illustrations given against descriptions. Number 1 is rotary microtome. It has a hand wheel that revolves 360 degrees to move the specimen vertically past the cutting zone and returns to its starting place. 2. Motors drive the rotary microtome's fine and coarse handwheels for manual, semi-automatic, or fully automated operation. Its benefits include effective 2 to 3 micron section cutting and adaptability to various tissue types. Lab technologists and pathologists benefit from microtomy automation in section quality, efficiency, and safety. Histology lab occupational health risks include repetitive motion problems from handwheel-operated manual rotary microtomes. 2 is base sledge microtome. In this microtome, the tissue block remains fixed while the knife traverses its surface during sectioning. Primarily utilized for large blocks, hard tissues, or complete mounts, and it is particularly advantageous in neurological and ocular pathologies. However, producing 3-micron sections are challenging. Number 3 is rotary rocking microtome. These are frequently employed in cryostats. The retraction mechanism displaces the tissue block from the knife during the upstroke, resulting in a flat surface on the tissue block. Number 4 is sliding microtome. In a sliding microtome, the knife or blade remains stationary as the specimen traverses beneath it during sectioning. This microtome was designed for use with celloidine-embedded tissue blocks, primarily for research purposes. Finally, 5 is ultra microtome. It is like a rotary microtome that creates extremely thin sections. These sections are essential for transmission electron microscopy with the thickness of 40 to 100 nanometers and scanning electron microscopy with the thickness of 30 to 50 nanometers and sometimes light microscopy. Diamond and glass knives are best for ultra microtomes. The section's thickness can be estimated with the help of an interferometer. Dear students, now, which is essential for microtomy? Yes, the microtome knife is important to cut uniform and thin sections of tissue. Usually, the microtome knives are made of steel. Various types of knives are available on the market. Side by side, please see the illustration given. They are: Number 1 is plano-concave. 2 is biconcave. 3 is wedge, and 4 is tool-edge type of microtome knife. A few years ago, histotechnicians sharpened or honed the microtome knives manually before stropping them for section cutting. What is honing? Honing is a process in histopathology that removes nicks and irregularities from the cutting edge of a knife, making it sharp and straight. Belgium glass or Arkansas stones are used for honing. Dear students, carefully see the video clip showing the direction of the knife moving from one end to another and the knife's edge moving from backward to forward and vice versa. On the other hand, stropping is the opposite process of honing. It polishes and sharpens the cutting edge of a knife after honing. Stropping can be achieved using chamois or horse leather. Nowadays, it's great that one can get microtome knives that are already sharpened and ready to use. This is a great way to achieve the thinnest sections from the tissue blocks. Dear students, please watch the video clip for the fixation of microtome knife in a holder. Step 1 is, after fixing the blade, the stage should be adjusted accordingly with the tissue block. 2 is, fix the tissue block into the microtome. 3 is, rotate the handwheel of the microtome and try to section the tissue block under the desired thickness in microns. On rotating the handwheel, the experienced technician or pathologist used to get the tissue section ribbon, which indicates the good tissue processing, nature of microtome and sharpness of the knife or blade. Number 4 is, transfer the paraffin section ribbon to the warm tissue flotation water bath with a temperature of 46 to 48 degrees centigrade. Fifth one is, after unfolding of sections in the water bath, pick up the sections onto the albumin or lysine-coated glass slides. Finally, number 6 is, drying the slides. Keep the glass slides in upright position in an oven or room at 38 to 42 degrees centigrade overnight. The above said microtomy or section cutting is applicable for soft tissues. Occasionally, hard tissues such as bones or teeth may be sectioned using a microtome. Still, obtaining thin sections for microscopy is challenging with hard tissues. Now, which method is employed for sectioning the hard tissues in microtomy? As a normal practice in histopathology labs, decalcification or removal of inorganic calcium from the calcified tissues like bones and teeth should be done. If you don't do decalcification step, what would happen to these hard tissues while cutting? Simple. The non-decalcified sections could affect the quality of the knife or result in inadequate section thickness. Decalcification is done after fixation during tissue processing. Usually the aqueous nitric acid, hydrochloric acid, formic acid, trichloroacetic acid, and perennious fluid are frequently employed as decalcifying agents. Dear students, finally I'm going to discuss the frozen sectioning. Histopathology uses frozen sections to quickly examine tissue samples. It helps to establish lesion extent, malignancy, and surgical margins, which are healthy tissue surrounding the infected or malignant area found during surgery. Pathologists and technicians freeze tissue in a cryostat. In local language it is called as refrigerated rotary microtome. The technician uses a cryostat to slice frozen tissue at -180 degrees centigrade. Then the cryosection is stained and placed for microscopic inspection. Lastly, the pathologist evaluates the sample and informs the report to the surgeon within minutes or hours. Dear students, we are completed the topic microtomy. Finally, what are the precautions should be taken while doing microtomy? Number 1 is, use a sharp knife. A dull knife can cause inaccurate cuts. 2. Use a new blade after cutting few blocks. 3. Optimize knife tilt, that is, the blade or knife is positioned between 3 to 8 degrees of angulation. 4. Use cold blocks. Chill the blocks on a cold, wet surface or melting ice. 5. Cut sections at the correct thickness, usually at 3 to 5 microns. 6. Trim blocks carefully and polish the block face. 7. Wear cut-resistant gloves. Wear gloves to protect your hands from sharp edges and objects. 8. Follow safety precautions. in a histology laboratory, you should also tie back long hair. Wear enclosed footwear. Avoid putting objects in your mouth. Cover any open cuts on your hands or other exposed skin. Dear students, I hope you all understand about the microtomy. We will meet once again in another video. Please like my channel, comment, share, and subscribe. Good day, all.